I never have fear to ask questions because till the time you don't ask questions, you will not get answers. So you have to ask the right questions to the right people.
You are listening Nursing Leaders Opinion, crafted by Nursing News India. Today we are going to talk with Swati Rane, who is a nurse and public health expert. Hi Swati, welcome to the show. Can you please introduce yourself and briefly tell us about your professional journey?
Hi, everybody. I'm Dr. Swati Rane from Mumbai, India. I'm a nurse entrepreneur. I did my bachelor's in nursing, and after that, I was working as a critical care nurse for a couple of years. And I realized that a lot of things are missing, which I want. I wanted to have good, healthy work environment for the nurses. I wanted good place for the patients to get speedy recovery, like having a garden in the hospital or having a small, good cafe in the hospital. That was my dream. And I started to hunt where can I get this type of dreams because I used to see these things in the international hospitals. And that's how I did my master's in hospital administration from Tata Institute of Social Sciences. And after completing my master's, I was working in one of the pioneer healthcare giants, corporate companies. And after working with them, I realized somewhere that, I need to learn also to how to plan and design hospitals. And that's how I started working uh, in a consultancy firm who is very much reputed and plans hospitals and designs hospitals. I worked with them for a couple of years. And then I realized that now I have to plan the hospitals on the sites. And I joined another corporate hospital company, which had around 5 hospitals coming in, which were from 100 beds to 350 beds. So at one point, I was planning around 5 hospitals. So I finished planning the hospitals, and then I realized that now I have to do something else. And I applied for my doctorate in hospital administration. And after completing my doctorate in hospital administration, I started my own boutique healthcare company called as SEVA Shakti. And during I had good good projects in various fields of healthcare, planning, training, acquisitions, policy making. And then I realized that the most important thing, what was missing, that I have to do something for nurses. Okay. And during COVID, I took it as a challenge to stand by nurses and do advocacy work for the nurses and the patients. And for past 1 year, I have been doing a lot of research work, a lot of advocacy work for the nurses and the patients. And I'm very happy that I'm getting good support from the nursing fraternity, from the healthcare system, from the nursing leaders, from the healthcare leaders, and also the political people to bring change. And that's how I am here as wearing many caps, like a researcher cap, like an advocacy activist cap, a cap of entrepreneur, a cap of a trainer and a coach. So that's how I am.
You were very active on social media during the complete lockdown and never missed a chance to indicate issues in healthcare. What motivated you for this?
Basically, I started my advocacy during COVID, that is from March. And I was very active on social media during the COVID struggle. That was only because that I could find many of the nurses who were frontline nurses. They had a lot of issues. Many were on strike. Many were not able to reach. Their voices were not reaching to the higher authorities. Higher authorities were not able to, go back to the nurses and help. And most of the thing was that, they were feeling helpless. And that was the time I thought the best way is to use social media. And on social media, you get everybody from the prime minister, to the health minister, to the chief minister, to all the people who are supporting to the nurses. And also the most important thing is the big organizations like WHO, they all, or UN, are all there. ICN is all there on the social media. So your voices can be raised if you tag them. And that was the best tool for me, or my Twitter handle was the best tool for me to reach to the right people and bring change. My whole thing was to get the answers or the solutions as earliest as possible and get people connected with me to fight for the cause. And the most important thing what I understood is that we all have to come together to fight this struggle, because COVID is not a problem which can be solved by one profession. It is a society's problem, it is the nation's problem, it is the globe's problem. So that is the reason I started becoming more active on social media.
You always promote a positive aspect of life and never hesitate in pointing scary comments made by people. How you do this?
Uh, Actually, I was always for the cause. Okay, I have always worked for a cause. So I never have fear, to ask questions, because till the time you don't ask questions, you'll not get answers. So you have to ask the right questions to the right people. So that is the reason, I understood that, you have to ask questions. For example, if the nurses were not getting PPE kits, I had to raise this question in the media. Why are the nurses not getting PPE kits? If the nurses don't get PPE kits, how will they take care of the corona patients in the ICU? That's how, when we reached to the media, and when media reached to the CM, because that time PPE kits were not available anywhere in the country. Okay. So when they reached to the CM, that time CM assured to the nurses that around they will get, at least 100 PPE kits, at least in that hospital will reach within evening. Okay. And that's how I understood that, getting bold is very important in today's world. Without being bold, you cannot get your answers and you cannot fight. Okay. So, and this is not actually a fight. This is actually, you're serving the nation by asking the right questions to the right authorities. So I think everybody should ask questions when they see there are problems, because problems always will get solutions only when you try to understand why the cause is there. And till the time you don't understand the cause, you will not get the solution. But for getting the solution, you have to reach to the higher authorities, to the system. Okay. And system and higher authorities, up to my knowledge, they always want to help. The only thing is that you have to reach them in the right spirit. They will not help you immediately. So you have to have patience. So this is what I'm doing.
We heard that family members of the nursing and other healthcare workers were denied treatment during COVID-19 peak time. What would you say on this?
Uh, as I told you, COVID peak time was a challenge for the whole country. Okay. And public healthcare system was already a system which had become like a old man. It had already collapsed. It was like, we used to say that, already the Indian healthcare system was already on the ventilator. Okay. Now with COVID, even the ventilator is not helping the system. Okay. So how do you help yourself? Okay, when you're on ventilator was a big question mark to me, because I'm a critical care nurse. Okay. So I always think critically. So if your nurses are not helped, how your patients will be helped? And that was my question again and again to each and every minister, that please, when you're making the task force, you involve nurses, because healthcare, 60% of your staff or your healthcare providers are nurses, and they're the backbone of the healthcare system. So if you don't give them representation in the decision making, in the team, your 60% problems are not solved. So if your 60% problems are not solved, your 40% cannot help the patient who is on the ventilator, that is your healthcare system. Okay, so you need full 100% staff to take care of that ventilated patient, that is your healthcare system. But if you don't have nurses in your decision making team who will solve their problems, and that same thing was happening again and again and again, the nurses were not given proper working conditions, they were not getting PPE kits, they were not getting proper time to rest. Okay, many of them were having diabetes and hypertension, so they were not even qualified to enter COVID wards. Okay, most of them were on the side where uh, they didn't have place to go back home. Okay, because their houses had senior citizens with them. So there were so many challenges which only the nursing personnel can understand. Okay, so in the team, I think uh, the whole team was very patriarchal. There was, in the task force, we didn't find any nurses, we didn't find many female doctors there. Okay, so I feel because of that exclusion of the nursing team from the task force, nurses were facing a lot of trouble.
There were many strikes for the unavailability of the PPE kits, salary issues for nursing and healthcare workers. Would you like to say something about it?
I feel nurses is a discipline or a profession which is always sidelined from the main healthcare stream. Okay, it has a history because nursing is always been considered as a help to the medicine, and medicine is like, is a father, and nursing is like a mother. So the whole decision making side, like a patriarchal system, the decision making thing will be done by the medicine people, and all the help, okay, will be done by the nursing people, which is not actually. Okay, nursing is a very professional body, it has its own knowledge body, and nurses don't have to depend always on the doctors to take care of the patient. Okay, so nurses can take care of the patient with the nursing care, and the medicos have to take care of the treatment part. Okay, where the nurses definitely follow the doctor's advice, but that is only related to the treatment part, but nurses work holistically on the patient. Okay, so the nurse will take care of the emotional side of the patient, the psychological side, the patient's relatives, what they need, what they don't need, the hospital administration side. So she has a big cake, and one small quarter is there, the treatment part, which is the medico. But now, in the current scenario, the three-fourth is taken care by the medicos, that is the help for the medicos, and one-fourth is for the nursing care. Okay, and most of the time, what you see is the nurses are mostly doing following doctor's orders. A, B is completing the clerical work, that is the administrative work. The point, that is the nursing care, they hardly get time to do it. Okay, so that is one of the reason there is no what you say understanding by the whole system of the healthcare system that nursing care is a big chunk, and they have to give nursing care to the patient for the betterment of the patient. So because the nursing care is not given that much of privilege, the nurse is not getting that much of privilege. Okay, so the nurses are not having voice. And in the history, because the nurses were treated as handsmaiden of the doctors, like, they have to help the doctors. Okay, this was not initially, like Florence Nightingale was very personality as a nurse. Okay, so she was not only at the clinical side, but she was also at the policy side, she was also at the hospital planning side, she was also at taking the decisions, okay, of the sanitation, the environment, how how the patient should be, from where how much sunlight should come to the patient, to the ventilation, to changing the sanitation, the sanitary plumbing to minimize the infection control. So she was involved in the whole environment to make the patient have a speedy recovery as earliest as possible. So she was on to the overall holistic care of the patient. But today, if you see, that part is being, slowly being taken out from the nurses. Like now, the nurses are having the hospital administrators who take care of the hospital administration side. Okay, the clerical people or the technical people, like technicians, taking care of the technical part. Like now we have OT technicians, we have ECG technicians. Okay, and doctors are there for treating the patient. So what is today a nurse doing is actually coordinating everything. Okay, and hardly giving nursing care. So most of her work goes in coordination and paperwork. That is what is left with the nurse, and that we have to change. And because of that, what the perception of a patient is that the nurse is there to help the doctors and the nurse is there to help the patient. But they are forgetting that nurse is there to take care, give nursing care to the patient. 24/7, the nurse is there for the patient, but hardly she is there at the bedside. So because of that, there is no voice. And if you don't have voice, you don't get respect. If you don't get respect, nobody wants to give you your what you say your rights are. But you have to understand that if the nurse will not get her rights, she cannot demand patients' rights. Okay, so advocacy means that nurses advocate for and on behalf of the patients and the family members to ensure that they make informed decisions regarding their health by helping them navigate an increasingly complex healthcare system, ensuring that complex terminology is easily understood by helping the patients and the family members with the ethical decisions related to care. So this is the whole part of advocacy, what she does for the patient. Okay, but for that, she should get her rights, and that is the missing link in the puzzle. And that is the reason our whole healthcare system is not running properly, because that piece in the puzzle is missing.
Hospital planning is an important part of healthcare delivery. What is your opinion on this?
I feel without technology, you cannot run your house. Like without the phone, without the smartphone, we can't even start our day. So if that technology is there for our day-to-day activities, you can imagine how much the technology will play an important part in the nursing care, in the healthcare. Definitely, the technology has come into the healthcare, but for the nursing care, it has hardly come. Okay, so I feel that for the technology to be useful for the nurses, I feel that the nurses should be on the side, on the other side of the table now. Like, for example, I was a clinical nurse and I felt that, the space in which I used to work, okay, was not sufficient for me, okay, because there was so much of machineries, because I was a critical care nurse, that also cardiac care. So you can imagine, like, with the cardiac patient, post-op cardiac patient, there are so many machines with which, you have to manage the patient. So many syringe pumps are there. If unfortunately a patient is on IBP, that IBP machine will also be there, plus patient's bed, plus patient's chair will be there, patient stool will be there. There will be a storage space. Okay, so in that small 80 square feet space, you have to manage the patient. And that was the time I felt that, somebody should plan this thing very nicely, where the nurse can work comfortably and the patient can enjoy, because almost every day the patient only sees is the ceiling, sleeping on the bed. Okay, and how will that patient recover? And that's how, I started reading about hospital planning. Okay, and I realized that, there is a course called hospital administration which teaches planning, and I applied for that, and I did my master's in hospital administration. Okay, and there was a time where I learned about space planning, hospital designing. And because I was a nurse, I could plan hospitals very, very nicely because I knew the operational flow. I knew what the patient wanted, what the doctors wanted, what the nurses wanted. But it was not that I stopped there. I used to go, whenever I used to plan a hospital, I used to go and meet the user end. I used to meet the doctors, the nurses, the technicians, the front desk people, and understand what do they want, how do they want, and then I used to plan my hospitals. So in the same way, I feel in the technology, our nurses should sit with the engineers, okay, and tell them that I would like to have uh, a device, which can tell me when my IV bottle is getting over. Okay, most of the time, uh, the nurse misses that and the blood goes back to the IV set. Okay. It is not that she does it purposely, but she's so busy with other patient. But if there is a device which blinks or which stops, it will be such a good thing for the patient and the nurse. Or even a simple thing about, giving reminders to the nurses about the next dose for the patient. Okay. Or even a simple thing like, a small device with the patient where the nurses give instructions. So this is the technology which will make the patients and the nurses life easier, and the speedy recovery will be there. But for that, I feel that the nurses now should sit with the engineers and become technocrats. Only then it will happen. If they are there on the patient side, it will not happen.
Do you think advocacy in nursing is important, and if yes, then why?
I think advocacy is important, not only in nursing, advocacy is important in the whole healthcare system. Okay. So, actually, what do you mean by advocacy? Advocacy means the nurse advocates for or on behalf of the patients and the family by ensuring that they make informed decisions regarding their health, by helping them navigate an increasingly complex healthcare system. Okay, because healthcare system has so much of complexities. Even a small disease like diabetes, okay, the patient does not understand the pathophysiology. He only understands कि sugar है, लेकिन वो sugar क्या कर रहा है, कहाँ से आता है sugar. They feel that if they eat glucose, I mean glucose in the sense anything sweet, okay, that sweet will turn into glucose and it will go into the blood. Okay, so the basic concept is not understood by the patient because it is very complex. At the same time, the patient does not understand the medications also because it is complex, especially if he is on an insulin. It is not so easy. Okay, so it is decision making is very complex for a patient. So there should be a person who will be there to stand ethically with the patient and tell that this is right for you, this is not right for you. This you can do, this you cannot do. And that I feel a nurse can do much better because 24/7 we are the only profession who is with the patient. So advocacy it's must for everybody, but more it is important for the nurses because they are there, okay, with the patient. And additionally, if you can see, also in the community, the nurses are more close to the families, to the societies. It is more easier to reach a nurse than a doctor. So advocacy is definitely important, and it is critical aspect of high quality and patient-centered care. Okay, if you want to give a high quality and a patient-centered care, advocacy is must. Without advocacy, I don't think the patient will be in the right hands. So it is must, I feel, yeah. Especially even in the crisis of the pandemic, okay, the advocacy was even more realized that it is needed because most of the patients were not getting beds, most of the patients were not getting treatment, most of the patients were not getting nursing care. So it was the nurses who were telling to the administration that this is what is happening at the ground level. Definitely, the doctors were also saying, but the nurses understood the holistic part of the patient's emotions and psychologies much better than the doctors because the nurses were more there with the patients. Okay, even what is required or what is not required related to the material, that also the nurses know much better because ward management is done by the nurse, not by the doctor. right? So hospital administrator will always be dependent highly on the nurse than the doctor. I, being a hospital administrator, I would be for the patient care, for the patient needs. I would ask my nursing department first. What do you think? What are the patients wanting more? I think the nurses would be the best link to all departments of the hospital, because they are the ones who are linked to everybody. So yes, it is very, very, very important. Nursing Nurses doing advocacy is very, very important, and it is a part of their syllabus also. The only thing is, unfortunately, because 80% of our healthcare system is private healthcare, and private healthcare doesn't give a good, healthy environment for a nurse to advocate for patients. That is the irony of our country.
How unions can play an important role for working nurses?
Yes. See, earlier, when I was a nurse, I was not allowed to be a part of a union because I was into a private healthcare. I was in a private hospital, which was a trust hospital, but we were not allowed to be a part of any union. But if you see in the public healthcare, nurses are part of unions, okay, especially in the government hospitals or municipal hospitals. So bargaining is more easy, or negotiating is more easy when when you're in a union, okay, because a nurse cannot single-handedly go in at an individual level and bargain. Okay, now what is that thing which I would say, what do you mean by bargain? Okay, that is the most important thing I feel we should understand. So the most important thing that any nurse would like to have is a healthy working condition, a safe working condition. Without that, it is very difficult for her to work. Okay. So if you see, in most of the cases, there is lack of autonomy, okay, for the nursing professionals. Okay. Most of the time, they will not be having power in their hand. They cannot take decisions. They are more fearful to take any risk, because they are sure to lose their jobs. Okay. So, and most important is that there is so much of workload on them that they hardly have time to even think about these things during their duty hours. Okay. And then they are also not having so much of knowledge about the working conditions, what are their rights, or what are the HR policies for the nurses. So they are not at all knowing about these things. And this, somewhere, I feel there creates a lack of support, okay, internally, and lack of confidence, because they don't have knowledge. So when you see the overall thing, then it becomes very important to have a union. Okay. But the union should be of professionals, it should not be of any political parties. There should be no political party union, because then it becomes a political event. Even the negotiations become a political event. So I feel the nurses, like abroad, like in Canada or in Australia or US, there are proper nurses unions which are managed by the nurses, by the nursing leaders, and the negotiations are done for the professional reasons. So that becomes more easier for them. And because of these unions, many nursing acts have come into place, which makes nursing practice more easier. And good nursing practice is good patient care. So it is important.
Since you live in Maharashtra, there are many vacant leadership positions. What is your opinion on this?
Recently, we did a nursing survey to understand the working conditions of the nurses. And the results were so poor that there were thousands of vacancies which were not filled for many years. Second thing, they have started getting contractual nurses, which is again a very, very dangerous, I can say, to have a contractual nurse, because you can understand, if she's on a contractual uh, work permit, what do you say? It is not a work permit, is not a right word, but if she's on a contract, Okay. And at the same time, there is a person who is working for the hospital who is a permanent employee. There will be big heartburn for her because she will be drawing very, very less salary, and also the perks what she would be getting for the same work would be very less. And then again it will have an impact on the patient care. So that was one big question to us, that why are they not filling the vacancies and why are they entertaining more of the contractual labor. So we had a meeting with the health minister where we had presented our whole study, and he promised that he will fill the vacant positions, because most of the positions which were vacant were at the staff nurses level and at the leadership levels. So if you see, we have in the government system, there are two positions which are given to the nurses. One is the ADHS nursing and one is the SNS nursing. Okay. So these are the two positions where under them there are more than 10,000 nurses. Okay. Definitely there are matrons and all who are going to take care of these 10,000 or 5,000 nurses. But one person cannot manage the policy making, administration, implementation. So somewhere there is a flaw in the public health organizational structure. So we need to have a nursing directorate. Okay, a nursing directorate is a place where there will be a leader nurse, topmost nursing leader, and she will be having at least around 7 to 8 leaders under her who will be responsible to the zones or to the hospitals. Okay, so right now what is happening, all the hospitals are managed, or all the nurses are managed by one person, which is not possible. So it is like one person cannot manage all the nurses. Okay, so that one person also cannot make policy level decisions because she hardly has people under her, and without proper structure there cannot be proper policies. Okay, so it is something like without people you cannot have work done. So I feel this is the basic problem in the nursing system, that we have to create leadership positions. Okay, and the leadership position should be centralized at the centralized level and at the decentralized level. So centralized level could be in the ministries, and decentralized can be at the zones. Okay, for example, we can have the way they have divided the circles in Maharashtra. Okay, so every circle should have one nurse leader who will take care of that circle with the medical director, whoever is taking care of that circle. So in that way, it will become easier to manage nursing in Maharashtra. If you look at India, there is only one nursing advisor in the ministry. So the whole ministry's organizational chart, if you see, there is one nurse in that whole chart. Okay, and she's going to see the whole country. Just imagine, is it possible? And she's powerless because she's a nursing advisor. Okay, she is not a director. So she is not having any powers to orders or change certain things. So how can a profession survive without proper leadership, without proper autonomous work culture, and without proper leadership structure? So if this is not, that the basic anatomy is not there, from where the physiology will flow? So this is what is missing in nursing, I feel.
Thank you very much, Swati, for giving your time for the show and sharing the thoughts and your expertise.
Thank you so much.